Hello family. For those who haven't seen any of my early videos, I'm a 54-year-old male who's been recently diagnosed with prostate cancer. So during my previous videos, I kind of shared that after meeting with my doctor, we decided that for now I would go active surveillance as a treatment option for now. And for those who haven't also seen my video, one of the things as I first got diagnosed with cancer, I kind of went online and looked at some of, a lot of doctors and specialists trying to understand a little bit more about prostate cancer. But also, I went and kind of looked at individuals who have shared their journey online. And one of the things that I kind of came out with is that each individual have their own experience that you resonate with. And so one of the things I want to do as I move forward with my journey is also share with the hopes that my journey can help someone else. Because again, one of the benefits, although I was looking at some of the doctors and they were sharing it, it kind of felt and came across differently when I heard it from someone or heard someone share their own personal experience. So not just what the doctors was sharing, but someone sharing their real life. This is what really happened to me. And so that's why I want to be able to document for others who come after me, to be able to share, not necessarily, here's what the doctor's saying, here's what the medical professionals are saying, but this is what is actually happening to individuals who are going through this. And so today, my biggest thing is being on active surveillance. I wanted to kind of talk about a little bit about active surveillance. And what does it mean as a treatment option? So first thing is, what have I learned about active surveillance? So what is active surveillance and why does it exist for those who want to leverage it as an option?
So why choose active surveillance? First, active surveillance is all about timing. Does this prostate cancer really need to be treated now? So why is this important? Well, there are side effects to treatment, such as sexual dysfunction, urinary incontinence, loss of fertility, and others. So when men can avoid these possible side effects of unnecessary treatment, this also improves their quality of life. Secondly, when we talk about active surveillance, as we delay treatment without compromising cure outcome, we also improve the possibility and chance that more advanced treatment options become available in the future. This also improves outcome.
So with active surveillance, what group of men who have been diagnosed with prostate cancer really are considered candidates for active surveillance? So what are the triggers that say this is something that could be a tool that I can use as a going forward option for my treatment plan?
Those who seek to go on active surveillance are typically have a Gleason 6 or stage 1 prostate cancer, or a Gleason 7 low risk stage 2 prostate cancer. These stages I cover in my previous videos for those who want to go watch. The other thing that's important is going to be your PSA and your PSA density. Typically your PSA is less than 10 and your PSA density is less than 0.15. PSA density is taken into consideration because there are men who have a larger prostate, and as your size of your prostate also impacts your PSA score, and so your PSA density factors in the size of the prostate as a consideration when you look at your PSA. The other thing that's going to be important is going to be your age and your health. So an older person may not have treatment because basically their life expectancy being impacted. And then race is a factor that we see. And lastly, going to be the patient and the family preference. Is does that person feel comfortable being on active surveillance or not?
So when I was chosen to do active surveillance, and it totally made sense to me to do so. I mean, the reasons why, one of the things that the doctor was saying was that, a Gleason 6 is a very slow moving cancer, and for some that it shouldn't even be called cancer in the way that it moves versus 4 or 5. So the understanding that it's slow moving, that you have time, even with most of the other, even the other levels, you have time to make a decision. That going on active surveillance was a easy choice for me to begin with. Some of my questions really centered around is, if you're going to do this for a long period of time, how are you monitoring this? Because one of the things that I would have, and as well as probably most men would have, is the concerns of the risk that what if they didn't diagnose it right? What if there's cancer somewhere and we don't see it and it moves out? What we do know and is is that if you catch this early, it's treatable. And so again, you probably, if you see my other videos, one of the things I always talk about is getting tested, because if you get tested early, that this is something can be treated and successfully treated with a high success rate. But one of the things that you want to do is catch it early. So with active surveillance, my biggest question to the doctor and my follow-up and things that I'm trying to better understand is, how do we actually successfully monitor this such that nothing slipped through the cracks? So traditional monitoring looks similar to this.
Monitoring for active surveillance typically consists of a blood test or PSA test, which is done initially every 3 months, and then it gets moved to 3 to 6 months over time. Then there's a biopsy, which is initially done once a year for the first 1 to 2 years, and then this can get reduced over time as your PSA test becomes stable. Typically, the biopsy are something that the doctor doesn't want to do because there are negative side effects of biopsies. Then there's the MRI and the rectal exam, which is believed to be done yearly.
Then lastly, my question with active surveillance is what is the overall outcome? And this is something I'm still deep diving in. Is over time, what does men experience? Do they experience situations where over time they stay on active surveillance for 10, 15 years? My initial conversation about my personal doctor is that there's not enough study yet to say how long, because this is a new thing, and so really understanding how long this occurs is new. And so that's one of the things I'm trying to understand, is that if I'm doing this, if it's 5 years, 10 years, it's forever, or is it just like I mentioned earlier in the videos, it's a delay, and that delay could be beneficial just from the standpoint of better tools down the road that makes any treatment more advanced and less invasive, or more successful, or more successful outcome, or is there some other my ultimate goal would be that I would never have to have surgery at all, and that eventually my PSA comes back down, and I can I'm not considered at risk at all. So what is the outcomes that we are seeing? I kind of did some investigation on that subject a little bit.
So when discussing outcome, this information is taken from the Journal of Urology. So in their study, what they found is that the progression of the disease while on active surveillance is common. So with that most patients eventually go on to get treatment. But the good thing is that what they're finding, that while on active surveillance, that the cancer doesn't typically migrate outside of the prostate, and with that the mortality rate for prostate cancer is already low, which in their study they had over a 99% survival rate for those who stayed on active surveillance and during their study.
So lastly, for me, the things that I'm really considering is that knowing that there is cancer, or what they say is cancer today, is in my body, with the potential that there could be others. There is some anxiety. There's some concerns that it's there, and just not knowing, just trusting that the medical profession team that's gotten it right. There is some anxiety there, and really over time is that the outcome, that anxiety over the benefits of waiting have to measure against that to be able to make a decision as to how long I continue this path. Again, scientifically, it makes all the sense in the world, and I really understand and advocate totally for going this route. And basically, as I've seen in other videos, is that not making a rash decision or a fast decision when you have time to investigate and learn more. So, I'm going to continue to study this as well as I mentioned. My other videos is not, now I've talked about active surveillance. Want to go and look at radiation therapy, look at that radical prostatectomy, maybe some of the other treatment options, and seeing how they're they compare to what I'm doing now, as those are options down the road if what I have currently continued to escalate or get to a point where I may have to make a decision on what to do next. So right now, I'm monitoring it. I'm learning. I feel comfortable with where I'm at and the decisions I made so far. I hope this information I shared today is helpful and benefit to others. And again, I continue to ask those who watch it, even if it's later down the road, watch the video, add to the comments if you have learned something else or something different, shared with the community so we can all learn. Again, thanks for watching my channel, and I appreciate it, and everyone have a blessed day.
The goal of this channel is to bring awareness to prostate cancer and prostate cancer treatment. My desire is to inspire, educate, and serve others by sharing my personal experience with prostate cancer and the knowledge I've gained along the way. Prostate cancer affects about 1 in 8 men in their lifetime. The challenge is that there aren't many symptoms, but a simple blood test can catch it early. Early detection can be life-saving. So talk with your family, friends, and loved ones about getting screened today. And if you are a man, talk to your doctor.